with it without Joe here too. I'll figure it out.
Testing, Brian Austin, can you hear me? Awesome, thank you.
You ready? Calling the meeting to order. Will the secretary please call the roll?
Director Harrington is absent, Director Robinson, and Chair Ryder.
All right,
You have a quorum.
thank you. So this is the Finance Committee meeting, 'cause I didn't say that, initially. The next regular meeting of the Finance Committee is scheduled for Thursday, October 17th at 10 a.m. Is there any public testimony? Is anyone registered?
We did not receive any registrations nor any written testimony.
Is there, the only member of the public here present is Fred Lebed. Fred, do you want to say anything? This is pretty easy. So there's, seeing how the only member of the public present in the meeting is to find the opportunity to speak, I think we can move on. Action items. First thing that we have on the agenda is the August 15, 2024 Finance Committee meeting minutes. These were approved by the board at the August meeting, but are being presented for the committee's review and discussion if necessary. Sam, since you're the only other member of the committee here today, do you have any corrections that need to be made to the minutes?
None that I'm aware of.
Okay, all right. I don't have to say it 3 times then. I will move the acceptance of item 3A, the August 15, 2024 Finance Committee meeting minutes. Is there a second?
Second.
Motion's been made and properly seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. The ayes, any opposed? The ayes have it. Motion passes. Any action items under, items under the Chief Procurement Officer? I believe, Charles, how are you? Our Chief Procurement Officer, Charles Jones, will be quarterbacking our 12 items. Wow. We had 55 contracts to go through last month, right?
Yeah. Oh, a few months ago, but
Yeah.
enjoy it while we can.
Last month was like 30 something.
Good morning, Charles Jones, Chief Procurement Officer. As Chair Ryder said, we have 12 contracts, procurement items in front of you today. 10 of those 12 require responsive letters from the Office of Contract Compliance. We have 5 complete and 5 in progress.
All right. Items 1 through 3 are going to be presented by Dr. Claudia Fegan, our Chief Medical Officer and sneaker fan. Claudia?
Okay, the first item is really continuation of usage of a uveitis physician from the Department of Ophthalmology at the University of Illinois. This is continuation of a contract that will be rolled into a larger service agreement with the University of Illinois, but this is to complete it, continue it through this month until we have the new, more comprehensive service agreement.
All right, go ahead.
Any questions?
We'll stop. There's only 2 of us. We'll stop you if we have a question.
Okay.
Sounds good.
So, the next, item is the, physician service agreement with the University of Illinois, and this is, providing, physician services, and, other professional services in radiology, nephrology, medicine, infectious disease, hem-onc, endocrinology, dermatology, cardiology, and surgery. So this was part of an RFP process, and we have, looked at which physician services we need from the University of Illinois, and this will be a comprehensive package over the next multiple years, we're hoping. And the last item here is for plasma, argon plasma coagulation systems. They're used in the OR and also in our pulmonary and GI clinics. And this is just a laser that we use to stop bleeding when we're doing more invasive procedures such as biopsies or removing specimens.
All right. Sam, do you have any questions?
No questions.
All right, thanks, Claudia. We're going to move on to request number 4, equity and inclusion, being presented by Shannon Andrews, our Chief Equity and Inclusion Officer.
Good morning. This item in the front of you is a grant-funded item. It's a request to extend and increase a contract with Chestnut Health Systems out of Bloomington, Illinois. This is a sub-grantee of a Department of Justice grant that we have for work being done around the evaluation of low barrier recovery home pilot. We had a companion piece that came last month for this. This company and organization is doing the will continue to do the evaluation in keeping with the extension and additional dollars provided from the Department of Justice. This will take us through September of 2025, not to exceed $200,000.
Sam, do you have any questions?
I'm just curious, what is a low barrier recovery home?
This program, which dates back to 2021, and I think we've done some work in this space before, actually addresses the need of housing insecurity for those individuals who have identified as having substance abuse programs specific to opioid and other type stimulants. And so, in addition to addressing the housing concerns and other recovery concerns, it is a program that is, there are roughly 4 people or 4 entities that participate in this. It's being implemented by Phoenix Recovery Support Services, but it really is having specialized programming and or resources and tools in terms of addressing opioid and addiction recovery, while also addressing the needs of housing insecurity.
Okay, thank you.
All right. I forgot. Are there any staff birthdays this month? Oh, the 15th. Happy early birthday. Any other staff birthdays this month?
I believe
Pam? 29. Happy birthday. Happy birthday. Happy early birthday. Anyone else?
Definitely Virgo season. And so, on behalf of myself and all of the Virgos in the organization, thank you. But yes, today is my 22nd birthday. And I will be doing what 22-year-olds do, after 5 today.
Well, I'm not as young as you, but I will be having my, third 49th birthday on November 29th.
I love it.
So-
Thank you, sir. I appreciate that.
Happy birthday,
Thank you.
Shannon. Thank you. Request number 5, Health Information Systems being presented by Angela O'Banion, our Chief Information Officer.
Good morning. Before you is the amendment for Evident, formerly known as Atos, which was approved and extended by the board and previously, and we are asking for this extension through 2028, which aligns with the recently approved Oracle Health electronic medical record and other periphery contracts. This extension will allow us to keep the vital resources in our technology department and our other revenue cycle, BOT, et cetera, across the county system. As you're aware, since mid-2016 or so, mid-20s, I should say, 2000s, IT has been primarily outsourced, and this is the vendor that has that outsourced contract for this period. We have, in any given year, about 175 IT resources, primarily around 125, and it flexes to 50 to 75, depending on the projects that we have. And I'm happy to answer any questions about this contract, but as you know, the majority of the contract is staff augmentation, and there are probably also, in any given time, 8 to 10 process optimizations. These process optimizations are work that are being led by executive sponsors such as Bina and Craig in various parts of the hospital, because the contract also allows for process improvements as it relates to technology. And as I said, the extension ensures our continuous support for also other initiatives such as our Express Care service that we launched recently as well.
Tim, you have any questions?
No questions.
All right. My only question is how many, maybe it's on there, how many extensions do we have left on the contract?
So this is the original contract. Say that one more time.
How many more extensions do we have on the left?
We expect this to be the last amendment extension request before we make critical decisions on the electronic medical record.
Okay, great. All right. Then we can, thank you. Thank you, Angela. Next is request number 6, nursing. Dr. Bina Peters, our Chief Nursing Executive. Morning, Bina.
So while Dr. Peters is coming forward, I'd like to make an amendment to this request. Specifically, the vendor name is ThirdPro International, Inc. And also the contract period and contract term will be modified to start October 1st, 2024 through September 30th, 2027. Just want the records to reflect that. Madam Secretary.
We will have the minutes reflect that. We can amend the paperwork on the fly, right, Alicia? Okay. All right. Go ahead.
Thank you, Charles. Good morning, directors. The contract in front of you for consideration for a new contract to manage the surgical SPD operation. And this contract, the vendor was selected through an RFP process, and this is the first contract that CCH is engaged with them. So, in summary, this contract to cover next 3 years, approximately $7.5 million, and then has also the capability of the two-time renewal options if you choose to.
Yeah, I want to ask a question really quick. We are amending the vendor name. The location is Canada supposed to be, is it Ontario, Canada, and that's it? It should be StereoPro International
Yeah, it's the
Inc.
same.
and not Canada
Yeah.
Mississauga,
Well,
right?
Yeah, it's the same for now with the Serco International Inc. However, we'll have an address for a stateside company, under International Inc.
Okay, because I can't
So-
make the amendment until that part is
Yeah.
given to me.
But it's still,
But I've noted on those
Ontario,
two
yeah,
amendments.
Ontario, Canada is fine.
Okay.
Just leave it at Ontario, Canada. Thank you.
Any questions, Sam?
No questions.
All right, thank you, Bina.
Thank you.
We're gonna now go to, requests number 7 through 12, operations and development. Alejandro Corona, Chief Facilities Officer, Plant Operations, on behalf of Craig Williams, our Chief Administrative Officer.
Good morning, everyone.
Morning.
I'd like to get started with HOH Water Technology. This service provider, they do chemical water treatment and filtration services at Georgia and Provident. Provident, there's no RO system, but there's other closed loop and other systems that they also maintain. We're looking to extend this for 6 months with no physical impact, with an end date of 3/31/25. We have we're currently developing the SOW, and we're looking to do an RFP in the next month or so. The next service is for Imperial Parking. These vendor provide parking management services for Stroger, Provident, and the Core Center. That includes the north parking lots. The vendor provides cashiering, janitorial, security services for these lots. The RFP has gone out. We're in the process of evaluating the bids, and we're looking to extend that for 6 months and add $1.5 million to cover the expenses. The following contract is for Novell Biocare USA. This service is to provide the continuation to provide the oral and maxillofacial implants and accessories to the patients of the oral and maxillofacial clinic over at Stroger, looking to increase it for 12 months with an end date of 10/13/25 and adding an additional $100,000. The next contract is for Velocity EHS. This is a sole source vendor. This is the vendor that is best positioned to provide this prescription service based on previous work housed in the MSDS online database. This is also a Joint Commission compliance and U.S. Occupational Safety and Health Hazard Commission, looking to extend it for 1 year with an end date of 8/26/25 and looking to add $26,483.59. The next contract is for Parada Services LLC. This is another sole source service provider to provide standardization with our current vial filling robot system. The vendor is the original OEM, the original equipment manufacturer, and will provide annual preventative maintenance at the, this is for, we can scroll down a little bit. Cermac, sorry. This is for Cermac, yeah. And the last contract is with National Business Furniture. This is to execute a new contract in the amount of $825,601.59. This is a one-time capital purchase installation. This will provide a refresh of furniture at Stroger from the lower level through the 4th floor. Some of these furnishings include waiting rooms, caregiver workspaces, patient and exam rooms. Also includes waiting chairs, task chairs, tables, and phlebotomy chairs. And I believe that's all for me. Thank you.
All right. Yeah, the new Bronzeville clinic is exciting. You have to buy furniture. There is no furniture. There we go. All right. Sam, do you have any questions for Alejandro?
No questions?
All right, great. Thank you. Charles, do you have anything else before we move on these items?
No, that's it for these items.
All right. So, with the corrections that were highlighted to the documents we received, I move to approve item 4A Contracts and procurement items retaining request number 1 through 12, subject to completion of review by contract compliance. Is there a second?
Second.
Motion's been made and seconded. Is there any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Nays, opinion of the chair, the ayes have it. Motion carries. Next, we will go to, the, MBE-WBE report that is being presented by Charles Jones.
All right, thank you. Before you on the board here, you see, for the month of May, MWBE metrics, there was 35 contracts brought before you in the month of May for $66 million. 13 of those 35 had contract-specific goals, a little bit over $34.8 million there. 2 contracts were awarded to primes for $3.9 million, roughly 11%, and 9 were awarded as subcontractors for $9.7 million at approximately 28%. We did have 2 waivers for the month of May in the total amount of $765,000. The contract with the amendment to for healthcare measurement and analytics platform for $420,000 had a full waiver, and the contract amendment for cancer registration services, $345,000, had a full waiver, so total $765,000. All in all, for that month, 39% for the month of May total on your CSS site. We get to the next slide for visual. Finally, on the far right, year to date, 53 contracts and a little bit over $263 million had goals. 7 of those were primes, $5.4 million. 37 was subcontractors for $79 million. So about 44 out of the 53 contracts, and approximately 32%, and approximately $85 million was awarded to MBWBE's year to date thus far. Okay, that'll be the visual with the bar chart. So here you'll see for the month of May, 39%, and so far trending year to date, first 6 months, 32%. Any questions?
Sam, do you have any questions? Nope, not at this time. All right. No, I appreciate the report.
All right, thank you.
And it's my understanding that we have no emergency purchases to be presented, so thank you, Charles.
Thank you.
Next up is items under our Chief Financial Officer, Pam Casera. I believe we're starting with grant award related items.
All right, good morning. Pam Casera, Chief Financial Officer. First item before you is the grant awards and renewals. Summarized at the top here, at the top there, you will see we have 1 new award, 300, looks like 2 new awards that total $344,000, and the rest are renewals for $2.3 million for a grand total of $2.658 million. Any questions on the grants?
Questions on the grants for me. Sam, do you have any questions on the grants?
No questions.
So I will move to receive and file item 5A, the grant award related items. Is there a second?
Second.
Motion's been made and seconded. Any discussion on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Aye. Opposed? The ayes have it. We're now going to move to the report on July financials.
All right, thank you. Next slide, Debbie. All right, so happy to report through the 8 months into July 31st, we're still in a very favorable financial position, $110.9 million favorable on an accrual basis, $76.3 million favorable on a cash basis. The key drivers remain the same, favorable revenue variances on the hospital and clinic side due to better than budgeted volume, and better than budgeted membership on the county care side. They're almost 21% over their budget. Next slide. So just again, looking at this slide depicts that what I just spoke to, total revenue line, looking at the variance column, $534 million better than budget, and driven, as I just mentioned, primarily 2 lines above, the $447.6 million related to county care capitation revenue, which is driven by the membership. And then on the expense side, 423 million worse than budget. Again, driven primarily a couple lines above there, that variance medical claims expense, 435 million, related to the higher than budgeted membership as well. But bottom line, net income, 147 million. We were budgeted to be about 36 million, so 111 million better than budget year to date. Next slide. This slide again just depicts the volumes, as I mentioned, that drive the revenues that are driving our good financial position. Everything is in the black here except for surgeries continue to lag behind at Provident. And that is, again, very small variance. As a percent, it's 6.3, but on an actual count of surgeries, it's less than one a day. And what is going on here is that we budgeted for OB-GYN and endoscopy procedures to increase for this year, but we've had slow recruitment in those areas. And I think, Dr. Figgin, didn't we just get those doctors hired? Yeah. So hopefully they'll either catch up by the end of the year or close that gap as those docs get started. Next slide. This again just depicts volumes in general over time. You can see we're again back to pre-pandemic levels and a slow upward trend. Next slide. Payer mix, again, we're keeping an eye on this one as the redetermination process is coming to an end. Our hope is that, you know, we will stay at above that 56% Medicaid and you know, the lower uncompensated. We have seen an uptick in the uncompensated, again, through the redetermination process, but now that the regular managed plans have gone through the full year of redetermination, hopefully that levels out. And revenue cycle, so again, we're still cleaning up the Change Healthcare issue. This was at the end of July. About 90% of our patient financial service operations were back up. Cash was starting to come in the door, but the posting solution, so we got the cash in, so cash collections are green, but we couldn't actually post it because the solution we used to do that was not up and running yet. So again, just still a mixture here of red, yellow, and green as we continue to clean up. And I will say that usually twice a year, we have Curtis come. He came in the spring to give a rev cycle deep dive, and we'll have him come either October or November Finance Committee, again, to give sort of an update on just the overall progress in rev cycle. Next slide, on denials as well. And here, as I mentioned, Director Robinson, you know, our reluctance to take the kudos on the denials because, again, the Change Healthcare issue is affecting us. You can see that uptick, and actually in the August as well, but we will continue as we work through the Change Healthcare and the posting of all the payments, then hopefully that'll come back down. And then charity and public program expenditures. Again, at the top line there, the charity care, as I mentioned, we are seeing that uptick in charity care through the corresponding decrease in the Medicaid coverage. You know, again, the redetermination process driving that, the freeze on the expansion of the HBIA, Health Benefit for Immigrant Americans and Seniors, also driving that. They capped that program last summer, so all the new arrivals, the new arrivals since last summer, basically are now falling to charity. But again, this is an annual, we just took the projected and, or the year-to-date actual and projected, annualized it. So again, hopefully that will level out as well now that redetermination process is mostly through.
Of course, we're a welcoming city. The system welcomes people, but there is, one thing to note is that the rate of asylum seekers and refugees has dropped coming into Chicago. I think we expected an uptick for 2 weeks in August that actually never came. So, so at least with that program getting capped and sunsetted to some extent, it's you know, we're also not still in a surge. Exactly. So.
Yep. And then next slide, our savings initiative. This one as well is sort of tied to the Change Healthcare issues, especially the items around rev cycle. Curtis, again, will give a full update when he comes either next month or November, but we do anticipate we'll get these caught up as we work through the cleanup. And then last but not least, of course, county care. The story is the graph at the bottom. The blue bars are how we budgeted. So we budgeted that decrease, significantly more of a decrease than what has actually happened. They've had great retention rates. The red bars illustrate the actual membership, and so they are significantly over their budget, over 20% over their budget on the membership, and are at 2.5 million, positive to budget. Any questions?
So are we having a party for the, folks who are responsible for this?
Aaron, are we having a party?
There it is.
So where's the bad news in the financial numbers?
There's no bad news. I would say we're gonna continue to monitor to make sure that that in fact we don't dip, the Medicaid, dips below, 2020 levels where we were in trouble, right? When charity was at such a high level. But I think, again, going back to the revenue cycle, initiatives that I've put in place the last 3 years, we're much better at, making sure we get people signed up as they cross our doorstep, right? So.
I think that's what my actual point was.
Yeah.
There's watch lists.
Right.
But in the face of the watch list, incredible growth that I don't think we've, historically seen.
Yeah, and we'll continue. I mean, it's a journey, right? So we're gonna.
Who's been here the longest?
Debbie.
You, Claudia. Yeah. Have you ever seen financials this strong in the last?
Yeah. So as we've spoken to, right, it's been largely the pandemic, the pause and redetermination, the expansion of coverage, the expansion to the immigrants, and then just improved revenue cycle processes.
Yeah. Well, I think, yes, we've had a lot of, positive intervention through different crises. But I think the infrastructure has changed dramatically, which I think has been able to take advantage of that, because if your infrastructure is bad,
Right.
you can get all the ARPA grants in the world, you'll find some way to fuck it up. So, yeah.
Did you just say that?
I did say that.
Fred left. All right. So congratulations to everybody on the finance team and on county care. So,
Thanks.
Sam, do you have any questions for Pam? No?
Great.
All right, great, thank you. Next up on the agenda would be our quarterly, VIA contract update. I think there were some questions about whether this report should reside in finance or HR. Could be that there's elements in both, but since we're down a member to have the discussion around that, my preference is to push the report to next month, do the VIA report next month, but also have the discussion about whether we want to release the report to the HR committee versus having it provided here. So we'll do both those things at our next finance committee meeting. Hopefully we'll have Joe here as well. So with that, I believe we have exhausted. No, I can't believe that I have to know it in order to adjourn the meeting. I know that we've exhausted the agenda, so we are adjourned. Thank you. I mean, that's pretty close to a record. 35 minutes? 33 minutes?